Thank you. I am Catherine from Lesotho. My article that I'm presenting to the audience there is the title is about underutilization of at Seboche Hospital by local community. In actual fact, every year under the facilities are being given the projected catchment population, of which we are aware of how many deliveries we are supposed to conduct in each facility. So hey, how do I go now? How do I now move? So I'm presenting this issue.
Hello, Catherine.
Under the summary, yes. Yes.
You have
Can you
an
hear
arrow
me?
button there? Yeah, I can hear you. Catherine, there is an arrow button
You can
down.
hear.
Please, Catherine.
Yes. This one. Okay, thank you very much. Seboche Hospital, amongst other services that it provides, is maternity services. And the services that are being provided in this department is all about antenatal care, postnatal, and as per 2016 projected population, 431 mothers annually, which means when we divide it by 12 months is more or less 36 mothers in a month. Here, sorry. So the topic of my article, like I said earlier on, is about the underutilization of maternity services by the people within our catchment area. That means we are seeing many people from outside our catchment area, but very few from the place where we are. And so far now, the facility has never met the expected target of women delivering in maternity. At this hospital, every month we are collecting data which is being analyzed so that we see whether we are meeting the set indicators or not. The indicators here could be the national indicators, the district indicators, as well as the facility indicators. And the trend showed that the facility never met the expected target, like I said earlier. The recent facility statistics indicate that for the past 6 months, being April to September 2016, only 43% of deliveries are or were the local people. That shows that 57% have delivered somewhere else. And this is a clear indication of fair uptake of intranatal care by pregnant mothers at the catchment area of Seboche Hospital, which needs the immediate attention. Where is this Seboche Hospital? It is located in Botabute district in the northern region of Lesotho. And the catchment population of our facility is for 2016. It is 14,200. And Seboche Hospital is providing various services inclusive of maternity services. The literature review here, there are a number of factors that affect the use of maternal care facility, health care facilities, such as income, education, ethnic background, birth order, and number of children. Therefore, Lesotho is not exceptional in this regard. After every 5 years, there is also the demographic survey that is conducted by the country. According to WHO 2014 report, Lesotho has a very high maternal and neonatal death rate being 487 deaths per 100,000 and 74 deaths per 1,000 respectively. This may be attributed in part to the high rate of home deliveries, which Seboche also is not exceptional in this challenge that the country is facing with. More than 40% of births in the WHO African region and WHO Southeast Asia region were not attended by skilled health personnel. That is according to WHO 2016 report Annex 1. Here is just the photo that shows by the time we were the team that was collecting the data from the delivery register to see how many local people are attending the services in our facility. The methodology that was used here was the quantitative method. And there was the Seboche Hospital. We had to compete it with one of the health center, which is referring most of their complicated cases to us here in order to find out how do people in that area of St. Peter's Health Center, how do they find the services at Seboche Hospital about the maternal health care. So the results that we got from the survey that was conducted, actually there were 120 questionnaires that were distributed. 25 were for St. Peter's, whereas the rest was for Seboche Hospital. But 15 of them were rejected because they were from people outside the catchment area. All in all, people that were interviewed and who were all responded were 105. This study or this survey was done in October 2016. Gender, age, number of parity, education, ethnic group, religion were the basic demographic collected, and all the respondents were Christian. Then the mean age of the mothers was 35 years. There was a general trend among the mothers to mention the issue of nurses' attitude during labor. 12 mothers from Seboche Hospital and 3 from St. Peter's Health Center indicated that some mothers related the concept of economic crisis and premature labor. Oh, sorry. All in all, the questionnaire wanted respondents to elaborate on how are the services offered by maternity department in the hospital. 77.92% showed that the services offered are excellent. 15.58 rated it fair and 6.49 rated it poor. There were issues raised by respondents that raised our institution's performance less than 85%, which is our benchmark. The graph below displays that. The reasons for less than 85% performance here, like I said earlier on, they mentioned the issue of the nurses' attitude. And the other one is about young nurses, of which they were even requesting the facility to bring back the retired nurses to work. This one we did not actually understand. What is it all about the nurses? The young nurses. Is it because the young nurses have got bad attitude or what? But it was clear that this one was only for young nurses. Maybe the older people do not want to be assisted by young nurses in the labor ward. So these are simply the references that I made from Lesotho Demographic Health Survey 2014, WHO 2016 report and 2014 report, and the data from UNICEF. The conclusion here, even though 77.9% of the respondents are satisfied with the maternity services, but from the above graph, our findings shows that nurses' attitude in the labor ward is the biggest challenge, followed by young nurses. Responding to the nurses' attitude, sharing of these results will be done with the management of the hospital, the heads of the departments, and the midwives. And there will be a need to train our nurses on excellent customer care at least once or twice a year. Concerning the young nurses, it is not clear, like I said earlier, about them. So there will be a need to do group forum from 5 villages, from the villages where the study was conducted, to find out the meaning behind this response of young nurses. Empowering pregnant women with decision-making skills regarding childbirth and to lower barriers that prevent them from growing to the facilities, because normally you find in most of the rural villages, the mother-in-laws are the ones who are leading. They are the ones who are giving the direction of when the daughter-in-law would go for the health services or not. So these people need to be empowered so that they can know their stand and then fight for their way, their health. There is a need also to improve the quality of existing facility-based deliveries and to strengthen linkages between traditional birth attendants and the formal health system. Because as much as we are facing this problem of HIV, but our people there in the rural areas are still conducting the home deliveries. Thank you very much for listening to my very brief presentation.